remember, aggressive prevention is actually preventing the condition from occurring to begin with. What we should be doing with regards to our health is basically advocating aggressive prevention. Aggressive prevention which is taking a comprehensive science-based approach to natural health, providing the most optimal environment so the body can heal, repair, and self-regulate as it's designed. I mean, doesn't that make sense? That the traditional kind of medical model looks at giving you, for instance, a medication to deal with a symptom, to deal with a crisis, not necessarily bad. In a crisis environment, in a world where we do have accidents, in a world where we do have genetic conditions, sometimes you might need a surgery and you might need a medication, but you would like to aggressively prevent conditions. And so if I say this, okay, taking blood pressure medication for a blood pressure condition is not aggressive prevention. It's not aggressive prevention by itself. If you have elevated cholesterol levels that are much higher than they should be, well, that's not aggressive prevention either, taking a cholesterol medication. If you're taking GERD or reflux medication, that is not prevention. Now, you could look at it from a certain standpoint. All these different medications could be trying to prevent something, trying to prevent a stroke, or trying to prevent, maybe esophageal cancer or something, Barrett's esophagus, something like that, if you're going to take reflux medication. But remember, aggressive prevention is actually preventing the condition from occurring to begin with. That's what we'd like to focus on. And so that's what we're going to be talking about today, because many of us are doing things today that are increasing our risks of having high blood pressure or hypertension. So if you look at, just to kind of give us a little bit of a context, that there is so much that you and I can do about our health. And this is just from the Centers for Disease Control. They came out and they said there are 200 heart deaths could be prevented each year. That's right. 80% of deaths from coronary artery disease can be attributed to preventable factors, things that you and I can do something about. That is exciting.